John, thanks so much for taking some time this morning. Really appreciate it. Why don't we just start with you giving us a little bit of your background, who you are, organization.
Sure.
Go from there.
Sure. So John Deezer, and founded Terra Health Coaching right before COVID. Came up in the healthcare investing world, surrounded by MDs and PhDs looking at the biotech space and then early stage clinical research, and kind of going through my own burnout, middle-aged kids coming along in life, and that whole process, and started just to ask questions. Again, we're investing in medications that were going to go out to the world and charge very expensive medications. And I started to ask questions of, is this necessary? And some of my colleagues at the time were saying, no, they're not necessary. And that just kind of never sat right with me. I found a like-minded group of medical professionals in the American College of Lifestyle Medicine, which has exponentially grown over the past 6 years, 6 or 7 years that I've known them. And then just started saying, okay, this doesn't make sense, this doesn't make sense, this doesn't make sense. And I don't like when things don't make sense, right? 2 + 2 can't equal 7.
Yeah.
And that's really what it was. So it's a medication that people are blindly taking because they're not getting the right support, and employers or payers are blindly paying for it because they don't have access to give that person the support. Our healthcare system was built for acute care, and has morphed into treating chronic care, but it's still sitting in an acute care house. So the things are just misaligned. So there's a lot of, and in the digital health revolution that happened during COVID, there's point solutions out there until you can look no further. But there's still a lot of opportunity to insert in to kind of help people out, and we're taking a very basic and simple approach to that with Terra. So kind of did a career transition, which I'm still working on both sides of that. Hence the relationship we have together and helping build Terra. But that's where we are.
Awesome. Yeah, and I go back to the first time that we chatted. It was a little bit early because you were just in the process of getting things all set up. But what was it about Connex that interested you, right? I mean, obviously early stage company,
right,
doing something that's a bit disruptive, albeit in a very commoditized space, so very difficult.
Yep.
So when we first chatted, what was it that interested you?
We're building a startup, right? We're building a startup, so any startup founder, if they succeed, everyone thinks it's all grand and great.
Yeah.
So I had two options where, do I hire a senior salesperson that has all of the network, or a large network and benefits and in the employer HR space, or we found you. I couldn't support we don't need a junior salesperson, we need a senior salesperson with the relationships.
Yeah.
I couldn't support a salary for that at this stage in our company, and I'm not even sure how we found each other.
Yeah.
But you guys kind of dropped out of the sky at the perfect timing, and it's working out.
Yeah. Well, tell me about the working out, because it's been, I don't know, what, 6 months, 6, 7 months, somewhere around there at this point. And to your point, that the biggest challenge for a startup, always, you got investors, or whether people are self-funded, whatever it is, the bank, as you talk about, is incredibly difficult when you're looking at run rate, and these are not short sales cycles. It's enterprise sales when you're looking at a large employer, right? So talk to me about the first part of our relationship. Let's get to the messaging, because that was something that is going to dictate success, right? How are you positioned as set against the belief system of the employer, because they're just going to, to your point, lump you into wellness or GLP-1, I got that covered, or that was conversations a year ago, we're figuring it out. But what you're doing is disruptive. So we did an exercise up front where we had to synthesize your value. Maybe you can talk about that process.
Yeah, and that was it was very supportive, where you guys are the experts in your field. You know the connections that Connex has. So I think we had several phone calls where we kind of pivoted the messaging, and that was your experience telling me, the founder, no, I think we should talk more about this. You need to open up more about that. So that was good, because you guys came in not knowing us and said and gave us some real life advice without beating around the bush. So that was very helpful, and I think just getting to that point of how to reach the employers. I want the results tomorrow. I want the results yesterday.
I was gonna say.
And you were always very upfront and would kind of get a good laughter out of it when I would get impatient and say kind of these things can turn around quickly, and it's not how this sales process works. So again, going back to, do I hire a senior salesperson that doesn't get the results for down the road? Now they can do their work and they can build the relationships and they can get things moving, but these employer sales cycles are not quick. So it really drums down to finding the right partners. Finding the right partners to get us to the 5-yard line, to have the real conversation. And again, those aren't going to happen tomorrow either, but if you think of a football field and the 100-yard football field, you're getting us to the 5-yard line. And that's an enormous value.
So let's talk about it, because now you get to the 5-yard line, right? So which is, we can position you there. And part of that positioning comes down to the preparation too, right? So what was that preparation like? So we've got the messaging, now it's giving you the business intelligence so that you can prepare getting into the meeting. Otherwise you're walking in blindly knowing, hey, I got somebody who'd like to meet with me, where's the starting point, right? So maybe talk about the prep.
And the cold calls, the pitches, every startup has done the pitches, and every startup has been told no most times. You've done the cold calls, you've got a million unanswered emails that people don't call you back, they say they'll call you back. So it really kind of gets down to both sides of the table between your partners and the vendors and the partners that you work with, the kind of the matchmaking, are well vetted and well informed. So I think the first couple of write-ups I had, the first line I wrote in the recap was, nailed it on the prep. Like I knew exactly what I thought the conversation would go, and how I prepped for the conversation was already ironed out prior to me making that connection. So it really vets out both sides on the matchmaking, and I don't think you'll put either side in front of the other if there's not a solid conversation. It might not work out, but there's a solid conversation to be had.
So we've got the prep, and now you've had, I don't know how many, probably had 10, 12 opportunities maybe at this point. Maybe talk about what that pipeline process is like for you at this point.
Overwhelmingly good. A good problem to have, where my flight is delayed today, and I'm actually relieved because it gives me a few hours to get things, all the recaps and all of the follow-ups, because each conversation is different. We don't have a blanket approach. Every pitch is kind of different. It's the same service, but we're very nimble and we can mold to different plans and different needs, because we treat each employee as a patient and not an entire employee population for one chronic illness. So it's a different approach, but we have to find out where we fit in each Connexion's health plan or employer structure. So each one is different. So that takes some time to follow up with them and kind of brainstorm with them and see where this fits. We were talking before this how it's kind of creating a new market. Sometimes we get put into the wellness category, but I say we don't do wellness. We help people get well, because wellness doesn't attract the people that aren't there yet, and those are the high cost employees. So we get people well, so then they can participate in wellness. And it takes a minute for people to understand kind of where it would fit, because it might be a new bucket. Even though it's not, it's all beneficial to many different sides of a health plan.
So if you were talking to John 8 months ago, when we started right at the beginning of this journey, what advice would you give him?
Patience. Patience. It all comes down to patience, because it's this has worked out well. You've nurtured us along as a young startup, Cecilia and myself, and you've told us, you've coached us. We do health coaching, prescription health coaching, but you've coached us, and you've nurtured us when we need to be nurtured. You correct us when we need to be corrected, and then you set us up for success. So it's kind of, when you think about it that way, it's very similar in terms of someone's health journey, someone's business journey. And again, we're a small team with a really powerful tool, so we kind of need that assistance.
Yeah.
So I think patience is key, and to keep your eye on the prize. You've been a believer in what we do as well, from your own kind of past history and what you've gone through. So that's been a help too, because every patient we work with, we do a breakthrough call before they sign up with us, so there's no charge or anything. We need to make sure that they are willing to invest in their own journey. Otherwise, it doesn't help anybody.
Yeah.
So there needs to be a believer in every piece of our business. So you're an outsider, but you're a believer. So it's been a big help.
Awesome. Well, John, thanks so much for taking a few minutes today. I appreciate it.
Yeah, thank you for having me.